We get tip after tip from many of you frustrated with rising healthcare costs. What you might not know, you have the power to see what different doctors charge for the same service, and you can shop around. New tonight, Target 8 is uncovering where you'll pay the most for some healthcare services in West Michigan, and then showing you how you can find a better deal. We're not talking hundreds of dollars, we're talking thousands you could be saving in healthcare costs. That's the gap.
Wow. Wow.
Rita Ladnier contacted Target 8, fed up with how much she pays for a doctor visit. But Target 8 discovered you can and should shop around because prices vary wildly from one place to the next.
Then you tell me how to shop around for the right doctor.
Target 8 first used healthcarebluebook.com, a site you can use too. It shows you what the Blue Book considers fair prices for all sorts of healthcare services, so you know if you're paying more than you need to. Check with your employer. Some companies subscribe to the site so their employees can shop around, and then you'll be able to see even more. It will show doctors and facilities in your zip code, listing them with fair pricing in the green, slightly higher in yellow, and those with the highest prices in red. Some even offer employees cash back for going green, going to facilities with fair prices.
That's what I don't understand. I don't know how one doctor can charge you more and another doctor can charge you less, or, gross amounts.
Isn't that wrong?
Well, first off, you need to understand, just like when you buy a car, the price you see as the sticker is very infrequently what people pay.
I sat down with Dr. Mark Fendrick in Ann Arbor. The U of M professor researches healthcare costs as part of the Medicare Coverage Advisory Committee.
Don't be enamored by the prices that are being posted. The best thing you could do is really understand your health insurance.
So Target 8 called several popular health insurance providers, discovering one just started posting prices online this year so patients can shop around. United Healthcare shows you what's covered under your specific policy and what you'll have to pay out of pocket. We found a common blood test costs $5 at Zeeland Physicians of Spectrum Health in Hudsonville, but $32 at St. Mary's in downtown Grand Rapids.
It's the same needle, it's the same, you take some blood. Why would it be so much more expensive?
That's one of the things I think we struggle with. And when we sit down and we look at something like that, we say, oh, okay, maybe that's one where we need to take a look at it and do an adjustment.
Michael Grant, Mercy Health's regional director for financial services, tells me they look at industry-wide charges on a regular basis, aiming to stay in the middle.
Does Mercy Health have fair prices?
I believe we do. I know when we look at comparisons across the state, we're one of the lower cost providers within our system.
And while St. Mary's was on the high end in one of our findings, it was on the low end in another. On United Healthcare's cost estimator, an MRI that runs just over $2,000 at St. Mary's costs more than $3,000 just a few blocks away at Spectrum.
Why would it be a more than $1,000 difference?
Spectrum Health Chief Financial Officer Ron Knaus says Spectrum is the most advanced hospital outside of Southeast Michigan, and that will affect costs.
We compare ourselves to other like institutions. Many of our services are only offered in a Ann Arbor or Detroit area.
They feel like they've been cheated over the years.
Dr. Fendrick says that in just about every circumstance, doctors and hospitals believe their prices are appropriate, but says now there's a bit of checks and balances.
We're starting to see a trade-off in terms of the wild, wild west of do whatever you want to a situation a little bit more accountability, both on the terms of the provider as well as the terms of the patient.
An advocacy group recently graded each state on how accessible prices are to patients. Michigan didn't do so well. We'll show you why tomorrow at 6. Plus, we're talking to a man on the front lines working to balance healthcare costs in our state. You'll hear why he says costs continue to go up. And we also have helpful links with this story, as well as a one sheet that you can actually print out listing off exactly what you need to do to find the right price for you.
It's such an interesting story because the hospital officials seem like they're agreeable to some sort of reform, or at least keeping an eye on this kind of thing. Is that checklist the place to start? Because I know a lot of people would love that tool.
I definitely would say that you want to start with the checklist because it goes through exactly how you can find what is the fair price. And that way, once you have that knowledge, then you can go through and see exactly how much you're paying more
or less.
Yeah.
You know, and then you'll know exactly where to start from. And that these are all so important because we are paying a lot more out of pocket now. More and more people, I just found research, are paying those high deductibles.
Yep, the prices are all over the place. You hope you're not paying for your surroundings, though. You want health care.
Right.